Hello dear friends, this is a very interesting case of a 26-year-old young male patient who presented with a sudden onset of severe central chest pain radiating to back. The pain was constant and the troponin test, the ECG findings, D-dimer were all normal. The patient had a very strong family history of cardiomyopathy. Two uncles died suddenly at the age younger than 40-year-old, and three cousins died also suddenly at the age younger than 25-year-old. So CT aortogram was performed to rule out any acute aortic pathology. Anyway, the aorta was absolutely normal. No acute aortic pathology was found. No other acute pathology in the abdomen and the pelvis and the chest. Let's scroll the images to have a general look. However, there was an incidental finding. Please have a look to spine and the sternum. I will zoom in some of the vertebral bodies to have a closer look. So as you can see here, there is a typical finding of a bone within a bone appearance in the whole spine. Bone within a bone is a descriptive term applied to bones that appear to have another bone within them. And this is just a descriptive term, and the differential diagnosis includes numerous pathologies. However, it is normal in the neonates and in infants, but if it is discovered in adults, there is some underlying pathology, definitely. So the differential diagnosis includes many pathologies like sickle cell disease, thalassemia, chronic osteomyelitis, Caffey disease, hypothyroidism, hypoparathyroidism, hyperparathyroidism, Paget disease of the bones, acromegaly, osteopetrosis, radiation, leukemia, oxalosis, and many others. However, specifically for this patient, for his age, I say again, he is just 26-year-old, there is a degree of loss of height of the vertebral bodies, some biconcave deformity of the vertebral bodies. As for the end plates, we can see that there is linear hyperdensity near the end plates and hypodensity centrally. As for the sternum, there is a degree of expansion of the bone and significant bone absorption centrally. A degree of central osteopenia is also seen in the ribs bilaterally. the whole skeleton is affected. Even the pelvic bones. I will scroll the images up to have a look to the pelvic bones as well. The purpose of this presentation is first of all to be aware of this finding, the bone within a bone, and secondly to be mentioned that the bone within a bone sign is a descriptive term, and it may associated with many different pathologies, so the differential diagnosis is very broad. The clinical findings, the history, specific laboratory tests are necessary to narrow down the differential diagnosis and to establish the final diagnosis. And the differential diagnosis can be narrowed down depending on the general appearance and shape of the vertebra and from the degree of the overall density. For example, in osteopetrosis, the overall density is higher. Here is the opposite. So, bone within a bone is a non-specific radiological sign infrequently encountered in clinical practice, with the exception of the normal neonatal spine, and understanding of the physiological and pathological mechanisms that can result in this appearance may aid in recognition of the underlying pathology, and this is more important than the sign itself. Dear friends, thank you for watching this interesting video. If you like my presentations, you can subscribe to my channel so you will be notified the next time I will upload a new video to my channel. Thank you again. See you the next time.